I'm Dr. Christopher Casscells. I'm an attending orthopedic surgeon at Christiana Care. I do most of my work at the Wilmington Hospital Division of Christiana Care, where we have the Center for Advanced Joint Replacement. The typical patient who's a good candidate for hip replacement surgery is one who is fed up with the pain. Two of the things I look for is, can you reach your foot to take care of your toes and toenails? If you can't, there's something wrong with your hip. And the other thing is night pain. Do you toss and turn all night long? Because when people become sleep deprived, it really affects their whole life. So those are two things that pretty much across the board are telling you that the patient's about ready. There are a lot of other more mechanical things about, have you tried to use a crutch or a cane? Have you tried pills? Have you tried this or that? Specifically, I don't recommend cortisone injections in the hip because they tend to accelerate the disease process very quickly. So that's not, even though that's one of Medicare's look for criterion, it's a really bad idea to inject a hip. The anterior approach I use divides the tensor fascia muscle. We push it to the side, we do not detach it, and then we come down directly on top of the hip in the front and work in between the muscles. Since we're working in between the muscles, it means they don't have to be sewn back together later on, which means they can be used right away because you don't have to protect the repair. The most important part about the anterior approach to the hip is the ability to keep the ball in the socket. The posterior and lateral approaches to the hip have a tendency to dislocate where the ball will pop out the side, out the back, essentially. It's very difficult, if not impossible, to dislocate a hip out the front. So the anterior approach essentially removes the complication of dislocation from the list of things you would have to worry about. It does impact the recovery process. Patients seem to have a very easy time recovering. They don't have the list of precautions that most hip replacements do. They're allowed to be full weight bearing right away. They don't have restrictions against bending the hip more than 90 degrees, restrictions against crossing their legs, getting down on a low toilet seat, getting down on a low chair. There are some hip programs around the country where they ask patients not to have marital relations because they're fearful of dislocations. None of those things apply to the anterior approach to the hip, so that does speed the recovery. The smaller the incision, the faster it's going to heal, and the anterior approach is a much smaller incision.